Welcome back. You are watching a series of 5 videos offered by the STTP Training Center. My name is Callie Stone, and this is video 4 of a series of 5 of the top 5 questions to ask your tongue thrust provider. So be sure to go back and watch the previous videos if you haven't, if you're coming into this sequence out of sequence, because each of them are important to understand the questions you want to ask your tongue thrust provider. So we are on question number 4, which is, what are the core principles in your plan of treatment? And we alluded to this in question number 2. Be wary of providers who are still taking a placement or behavioral or appliance approach to tongue thrust treatment. These approaches definitely do treat tongue thrust, but they do not often eliminate tongue thrust. And we'll talk about why that is. A common example of this articulation or placement approach is where the provider, which is usually a speech-language pathologist, will train the patient where to put the tongue for proper resting position as well as during articulation. And so many times this therapy is very effective for correcting articulation errors. And the client can become very skilled at knowing where to put their tongue and to eliminate those articulation errors. The problem is it doesn't carry over to the underlying cause of the tongue thrust, and it does not address the reverse swallow. And so oftentimes, like I said, they're very good at it, effective at correct articulation, and can even tell you where they should put their tongue, but rarely will you find it there on the resting posture, and never will you see an impact on the reverse swallow. Okay, so another example would be the orthodontic patient who can be found. There's many different appliances, but whether it's a basket that is put in to help train the tongue in the proper placement, or maybe the orthodontist is taking the spike approach, which is kind of an adverse response. So the spikes are there to detour the tongue from resting where it's not supposed to. And so whether it's trying to place the tongue properly or trying to reposition the tongue with the spikes, neither one sticks. It may work during the time that appliance is in, but the concern is actually training a dysfunctional tongue. So instead of having a tongue that's just weak and probably uncoordinated posteriorly, it doesn't address that at all. It doesn't address the weak base of tongue, and it doesn't address the swallow at all either. So as soon as those appliances come off, you either have a regression right back to the same tongue thrust, or you have a more dysfunctional tongue thrust than you started with. So be wary of those approaches for those reasons. They don't address the underlying cause, and they don't address the resting posture, the tongue thrust, and the swallow. They just address generally the tongue thrust. Okay. The Stone Tongue Thrust Protocol, or the STTP, focuses on education and awareness. That is first and foremost, because you can't change something that you don't understand. And then next, we pair the oral muscle isolation and training. That is critical, because unless you isolate and train those muscles, it doesn't matter where you tell it to go, it can't sustain it. And it has to sustain it at rest, articulation, and swallow. Okay, just addressing one or the other is not sufficient. So you do have to have the oral muscle isolation and training to eliminate the tongue thrust resting posture and to train the reverse swallow. So we address that reverse swallow. And each aspect is critical to the rapid elimination, not just a temporary treatment, but the rapid elimination of the tongue thrust, and is the reason that the outcomes for the STTP, the Stone Tongue Thrust Protocol, are revolutionary and are different than traditional tongue thrust approaches. So we'll talk about that more with question 5. Join us on the next video.